We are members of an international, multicultural congregation of Franciscan sisters.
We are committed to live the gospel in the spirit of St. Francis of Assisi, our founder, Father Christopher Bernsmeyer, Order of Friars Minor, our founding sisters, and all those who followed them.
We are committed to live a simple lifestyle in community. We find a challenge in the values of the third order regular rule, conversion, contemplation, poverty, and humility.
We are dedicated to a common mission that brings Christ's healing presence to humanity and supports creative ways of responding to the sick, poor, and needy.
We witness our Franciscan spirituality
by reverencing all creation,
living and promoting peace and justice,
and respecting the dignity of all people.
These values, shared by the Hospital Sisters of St. Francis, are the foundation of a healing ministry rooted in the gospel teachings of Jesus Christ and practiced by St. Francis and St. Clare of Assisi.
Jesus' ministry to the sick was filled with compassion, and his compassion often overflowed into healing that person. But he not only healed the person physically, he healed them in spirit and their souls. St. Francis and St. Clare ministered also with compassion, so that's really a key ingredient.
In the scriptures, it says that Jesus gave us two primary charisms or gifts of the church. And those charisms are teaching and healing. And our sisters received through Francis and Clare and Jesus the charism or gift of healing.
I think that's part of the charism of St. Francis, that he did follow Christ even though he didn't know clearly what way he should go. He didn't go immediately to Rome and say, I want to organize a church, I want to organize an order, I want to organize healthcare. He didn't do any of those things. He just worked with the brothers and responded to the people.
The lessons of St. Francis' life in the 12th and 13th centuries are relevant today. As a young man, St. Francis liked to party, enjoying the pleasures of life afforded to the son of a wealthy merchant in Italy. Later in his life, Francis came to understand the power of God's healing love by renouncing his wealth and committing his life to helping the poor. To demonstrate God's love, Francis and his followers would care for the lepers who were banished outside the walls of Assisi.
Francis realized in his encounter with the leper, that was his experience of conversion, because he could not do that. Before that, he was really repulsed by leprosy and the lepers. And when he was able to embrace them, he was just like a new person.
The lepers that we minister to today are the alcoholics, the people with AIDS, the homeless, and they all need to be cared for in the same manner that we care for other patients.
The Franciscan movement continued to grow in the centuries to follow. Orders of Franciscan priests, friars, and sisters provided health care, education, and other services to those in need. In 1844, the Hospital Sisters of St. Francis were founded in Germany.
Father Christopher Bernsmeyer began the Hospital Sisters. He's considered our founder. And he was a Franciscan priest in Munster. And Napoleon and his troops came in and closed the monastery. There was a religious persecution going on in Europe at that time. And so Father Christopher went to Telte and was appointed pastor of St. Clement's Church and given the responsibility of the little pilgrimage chapel called Our Lady of Grace. And that chapel is very significant for us because it was where the first women dedicated their lives to God in service to the sick and the poor.
The sisters were the ones who brought the energy and the vision to kind of focus their energies into the healthcare of the people that they were working with in Münster, Westphalia, Germany.
Facing a second round of religious persecution by German Chancellor Otto von Bismarck, and recognizing the need for healthcare services in America, the hospital sisters responded to the call to serve others in a new land.
In 1875, Bishop Peter Baltus, who was the bishop of this diocese, saw that he was having more and more German immigrants come to this country and to his diocese, and he felt that they were not getting the medical care that they needed. So he wrote to our sisters in Germany and asked if some sisters could come to America and minister to these German immigrants.
The journey to America was a difficult voyage. The diary of Sister Crispina Topp describes the ordeal.
The waves covered the ship, and the water came in streams. It came even into our cabins. The captain begged us to go to bed. He was afraid someone or something might fall over us. We heard dishes and basins break, and baskets full of broken dishes were thrown overboard. It seemed like the destruction of Jerusalem, and the captain thought it might last 3 more days.
History tells us that when it became very frightening because of the waves and all, the sisters would sing, and they would come together and they would sing and they would pray, and others would calm down.
Knowing our sisters, they probably took care of other people, but they also became ill themselves along the way.
After arriving safely in New York, the sisters boarded a train for Alton, Illinois. From there, Bishop Baltus sent them out in small groups to serve the residents of East St. Louis, Belleville, Litchfield, Effingham, and Springfield, which would serve as the site of their mother house.
They didn't speak English, so they came over with really not much preparation for life over here, but they had the desire to care for the sick.
They had to go out and beg for the food for themselves as well as for the patients. They would hitch up a wagon and go to the farms and get some grain that they would get ground into flour for bread. And most of it they gave to the patients.
The sisters then were given a house, and they went out immediately and started caring for the sick in their homes. And they were not given money, but were given chickens and eggs and vegetables to take care of themselves.
When they came over here, they went to the Ursuline sisters, took them in for several months and taught them English, and then they were able to sit in some of the lower classes of students in the grade school classes, so their English would be more simple and easy, something they could learn from and engage in. So that would have been, I think, pretty humbling.
The sisters began to bring patients into their home, the very, very sick patients. They didn't want to leave them, so brought them into their home. And I think the people of the area saw what was happening, and of course they only had so much room to bring these patients, and so helped the sisters build a hospital. Little did they know that within 3 years, 3 hospitals would be built, and within 20 years, 12 hospitals.
The sisters in Springfield changed the culture of Springfield in regard to health care because of the way, the how we took care of people. We were able to not only take care of the poor, but the rich noticed that we were taking better care of the poor in our hospital, our early hospitals, and at home, than they were getting care. And that is why I think we were also asked to take care of richer people or more prominent people like Mary Todd Lincoln.
She was living at that time in the home of her sister, Elizabeth Edwards. And Sister Frances, one of our first sisters, went to the home and sat with her.
We do know that Sister Frances and others stayed the night, stayed perhaps around the clock with Mary Todd Lincoln. And one of the documentation says something like, she was a nice lady, but I didn't like her dog.
As the hospital sisters' reputation for providing high-quality, compassionate care grew, other communities asked for their help.
We were invited to go to Wisconsin, and we sometimes for special need. So we were in Chippewa Falls because that's where there were a lot of lumberjacks, loggers. And they needed a hospital because it was a high-risk job.
What we did in order to raise some money for that hospital was to sell tickets. And those tickets were for health care. And they were on sale for $5 or $10.
In Green Bay, it was a bishop that invited them to come. And in Eau Claire, they were asked a number of times before they actually sent somebody. But how that all happened was a need was presented to them, and what they could do, they did. If they saw something needed to be done, they did it.
As the hospital sisters' healing ministry grew to meet the needs of the communities they serve, they continued to be self-reliant, industrious, and innovative.
In those days, the sisters had a farm. They had chickens and cows, and we had barns and vegetable gardens, so that all the food that we had from those animals and a garden fed the patients at St. John's Hospital and the sisters who worked there, as well as all the patients at the tuberculosis sanitarium and the sisters at the Mother House.
We had a number of sisters that came over almost every year or every 2 years after the first sisters came from Germany. And none of them were educated, and none of them were, of course, nurses. But that was our mission, to care for the sick. And so our sisters saw the need to have an educational facility for our sisters, the young ones as well as the professed sisters. So they started St. John's School of Nursing.
There were a lot of changes in health care in those years, in the late 1800s and the early 1900s. And so as they got more knowledge, they got more techniques, they probably at that point realized that we can't just go by what our senior sisters or senior nurses knew.
Our systems pioneered and developed the whole respiratory therapy. It used to be called inhalation therapy. But they recognized the need that those services to the patients needed some special preparation for the caregiver.
Throughout our history also, we developed postgraduate courses in like medical technology, radiologic technology, anesthesia, surgical nursing, and again, to keep the sisters and the people who would go through those programs updated into modern medicine.
During the 20th century, the hospital sisters expanded their healing ministry, both in the United States and overseas. At different times during the past century, the sisters cared for Native Americans in Arizona and New Mexico, oversaw nursing homes in Missouri and Louisiana, ministered to post-polio patients and patients afflicted with cerebral palsy in Springfield, established hospitals and missions in China, Japan, Taiwan, and Tanzania, and served in Haiti. In 1978, Hospital Sisters Health System was incorporated. HSHS supports the system's hospitals, clinics, and physician practices through such services as information technology, long-range planning, advocacy, and mission integration. HSHS also serves as a unifying element between all system affiliates.
We have developed a symbol for the system for all of our colleagues and for all of our institutions that is more of a modern type of our sister symbol.
The Tau Cross is something that's been very much a part of our religious community, the Hospital Sisters of St. Francis, and also before that part of Franciscan history.
Around the Tau cross is a broken circle, and that could symbolize a lot of things, but for me it symbolizes the opportunity for growth, that we're not finished growing yet, that we will continue to grow.
While the Hospital Sisters health system continues to grow to meet the needs of patients today, its values remain constant.
We have 4 core values: respect, care, competence, and joy.
For me, respect is the whole thing. I think, first of all, we have to respect ourselves. If we don't respect ourselves, we can't respect others. That's very important. And sometimes people have a low self-image of themselves, but we really need to respect ourselves. We are made in the image and likeness of God, and He didn't make junk.
Care is really acting with and for another. When we care for someone, that's conveyed. They're important to us. We're not just doing it because it's a job, but we're doing it because we really care. We want this person to be better.
Competency, you do the best job you can, you learn, you're open to learning new information, constantly being a learner.
I like to think of joy as a sense of peace. If there is a sense of peace within us, we're going to be joyful. It's going to radiate and come across to others.
Franciscan joy is not the same as maybe what we think of as pleasure and indulgence and that kind of thing, the joy of the world, but rather a joy in Christ. And to know Christ and to know that we're doing the kinds of things that He tried to do in His lifetime.
The future of Hospital Sisters health system is now in the hands of those called to join our common mission, to be Christ's healing presence and respond to the health care needs of the communities we serve.
We're grateful for the growing interest to discover Franciscan values in healthcare today. And I'm happy that we have people who are willing and interested in sharing in our tradition.
I don't think too many people go into healthcare unless they really have that. They go in because they love people and because they have compassion. They have compassion for people who are suffering. And I don't know how anybody could stay in that kind of a field of work unless they really had that.
Our sisters in their healthcare ministry, they always had that healing presence. They talk about St. Francis saying, preach the gospel, always use words if necessary. Well, sometimes our sisters really didn't need words. They just showed up. Our sisters that were head nurses, and most of them were, they knew who was very sick and who might die during the night. And they would get up in the middle of the night and they would go sit with their patients. And they did that over and over.
When we get to a point of frail health, we get to the point of the end of our life, we're all kind of the same. And I think our sisters ministered to those with means, those without means, as though they were all one.
I think the how we do it and the why we do it, or the spirit that we do it in, will not change.
I always say put the moccasins on and run with us, and then you'll find out. If the moccasins fit and you feel good, you'll know it, and you'll know that that's where you belong. And we want people to run with us because we can't do it ourselves. And that's why we say often we're passing the torch to you.